This is a consolidated.
Hello.
Get started, folks. We'll call the meeting to order, and I'd like to begin by acknowledging that we are in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. So tonight is about a special council meeting, and we do have a presentation later in the evening here. But our first order of business is to deal with our audited financial statements. The audit committee dealt with last Monday night, was it? Michael? Last Monday night, okay. You know, so we've been, the audit committee's been through it, and in a briefer form, Heather's going to go through it and then to all council. And I should make you aware of who's online. With us, Brian is with us online, and our deputy warden, Wayne Murray, is with us online, and Logan is with us online. Brian is with us there, I think. He gets double pay for tonight. So without any further ado, then I am going to turn it over to Heather and let her present the audited financial statements ending March 31st, 2021.
Thank you so much. So I will, as alluded to, the audit committee, we spent some time going through this last week and spent a lot of time going through it in detail. So my goal tonight is try to make this brief, but hopefully enough information so you can understand them. So I will start with, and I'm assuming you all have received these as they were sent out. Page 1 is where this report represents management's responsibility for the financial reporting. This is a report that's attached to the financial statements that merely points out the responsibility of management for these statements. Page 2 and 3 is our audit report, and on this report is where it's identified first and foremost our opinion as the independent auditors. How we arrived at that opinion, the responsibility of those charged with governance, you as council, through these financial statements, and under the auditor statement. So in brief, I will read our opinion. In our opinion, the accompanying financial statements present fairly in all material respects the financial position of the county as at March 31st, 2021, and its results of operations and its cash flows for the year it ended in accordance with the Canadian public sector standard. If there was a deviation, it will be pointed out in the report, but I always suffice that. If there is something significant, we wouldn't necessarily wait till now to bring it to council's attention. Therefore, it is a clean audit report to you. Page 4 is the consolidated statement of financial position. And what this this page reports on is the assets and liabilities of all of the funds that are being maintained by the municipality of County of Pictou. Those funds include the general operating fund. And this is where, of course, the taxes are rendered and the operational costs are recognized. You've got water operating fund, which also reports on the revenue generated from the sale of water services and those expenditures to provide that water service. There's also some capital funds, the general capital fund, of course, reports on the infrastructure within the general fund. Water capital fund, of course, that's pretty self-explanatory, reports on the water infrastructure. And new this year is the Infinite Project Capital Fund, reporting on expenditures to develop that infrastructure for the county. So the combination of all of those funds and the related reserves, there's 10 million in assets, including cash, some receivables from taxes, receivable from other sources such as HST, receivables from other entities, New Scotland Business Development, Rivet and Guest Home, and some other receivables from residents, equating to the 10 million in assets. The liability, these are amounts that are owed at the end of the fiscal year, was just around 2.3 million, most of which were trade accounts payable and accrual, and most of those related to trade payables, construction payable amounts, and payroll accrual. There is some prepaid accounts also included in the financial liabilities. The non-financial assets that are reported on include all of the infrastructure that is maintained by the municipality. The net value is 54 million. Some other non-financial assets include the investment in the New Scotland Business Development Incorporated and the prepaid expenditures. The total accumulative surplus position for the municipality of County of Pictou March 31st, 2021 is 62,626,000. Page 5 is the consolidated statement of financial activities, and this reports on the revenues and expenditures that were generated and incurred during the last fiscal year. A total revenue generated of just around 18.5 million. 16.5 million of that was generated in the general operating fund. Most significantly, of course, is taxes rendered. There is approximately 400,000 generated in the water revenue fund. Approximately $1 million in grants for capital, and that's gas tax funds. And some other sources of revenue as well, most of which are, of course, grants received from other sources. The expenditures equal to approximately 17.4 million, most of which are part of the general fund. Those would be including the general government services, protective services, transportation, environmental health, environmental development, and recreation, and cultural services. All of those expenditures are recorded within the general operating fund. Most significantly, you've got the general government. Of course, that includes all of the costs for administration purposes. Protective services, those would include costs for RCMP, fire, and those types of expenditures. Transportation, of course, that includes maintenance of sidewalks, streetlights, and roads. Environmental health services, those include garbage collection, recycling, and those types of expenditures. Development include expenditures to develop to provide development services for the county and with the member municipal units. Recreation services, of course, self-explanatory, that does provide recreation services for the residents of the county. And cultural services, most of which relates to the library. Water utility service expenditures total 445,000. Those are costs to provide water services. And some other transfers and grants of $1 million, most of which is the transfer tax. The March 31st, 2021 incurred a surplus of just shy of 1.1 million. Again, bringing the accumulative surplus to the 62,626,000. Page 6 The consolidated statement of changes in net financial assets. Those changes within the non-financial assets in terms of the acquisition of capital assets, the amortization relating to those assets, and some other capital exchanges. Page 7, the consolidated statement of cash flow. These cash resources are generated in the fiscal year. There was an overall decrease of 1.3 million in cash resources, most of which, of course, was used for capital purposes. Page 8 is where we're going to start seeing some of the results for the individual funds. The schedule of general operating fund reports on the taxes rendered to residents and some other sources of revenue. So 16.5 million, of which expenditures of 14.8 were incurred. From the revenues generated, however, there was also some amounts that were used to fund other funds within the consolidated statements, which include the municipal services grants, the streetlight replacement reserve, the fire protection charge that's charged to the water operating fund, and it funded some of the capital purchases during the year. So the overall change in the operating fund was a surplus of just around 739,000, all of which, of course, is transferred to your operating reserve. Page 9 is the schedule of water operating. This reflects the revenue for the sales of water and the expenditures to provide those water services. And again, some of these transfers that are happening between these various funds that resulted in a surplus that was generated of just around 81,000 during March 31st, 2021. There was a deficit at the beginning of the year, so the resulting impact is that deficit has shrunk, so it's approximately 250,000. Page 10 is where we start to see some of the capital funds. The general capital fund reports on those infrastructure that was acquired for the capital, for the general purposes. Those would include transportation, environmental, general government, and of course the investment in New Scotland business development. The total capital additions, 483,000, most of which was funded by the general operating fund as capital revenue, and some was funded by the capital reserve. Page 11 is the internet capital fund. The total infrastructure that was acquired during the last fiscal year was 3.7 million. Most of that was funded from gas tax funds. The rest was funded by capital reserve amounts and from temporary borrowing that will be in place subsequently. Page 12 is the water capital fund. The infrastructure additions this year in the water capital fund were just around the 33,000, all of which was funded from internal sources. So there is an actual some cash within the water capital fund funding the addition. Page 13 is the water capital fund, statement of financial position. This provides some further explanation in terms of what's being held for assets and liabilities within the water capital fund. Page 14 is the schedule of the reserves that are being maintained by the municipality of County Pictou. At the bottom of page 14 is where you'll see the list of those reserves. There's the capital reserve, street light replacement reserve, the gas tax reserve, Valley View replacement reserve, the rural broadband project reserve, municipal services grants, that sales surplus reserve, and of course the general operating reserve. So the funds that come in directly to those reserves would equate to some investment income, some interest that's earned on the funds held. Of course, we did see a significant reduction on the interest earned this year. Resident share of capital costs. And there was a provincial COVID safe restart grant provided. That's been recognized in the fund, approximately 259,000, as well as the gas tax. Gas tax of $1 million was also received. The financing and transfers, of course, equate to what was used basically to fund capital additions during the year. Page 15, I have to apologize, by the way. This is the consolidated statement of the property and equipment. So this includes, discloses the general internet and water capital fund, the infrastructure for site, and the amortization per site, bringing each to the what's being held for the net value of capital in each of those funds. Page 15 is the reconciliation back to your consolidated municipal position of $62,626,000. The next few pages are the notes to the financial statement, pages 17, 18, 19. Through to page 20 are the accounting policies. So these are fairly exhaustive in terms of how numbers are arrived at. There's been no significant changes to the accounting policy during the year. Page 21 is the taxes receivable note that discloses how we get to what's being reported on the financial position for $1,445,000 in taxes receivable. And a schedule of what's included in the other taxes receivable in terms of water, some COVID advances. We pay Page 22, note 3 provides for some descriptive information for those receivables in the other category. The valuation amount, the policy is to disclose the uncollectedness of any taxes in arrears. So these amounts basically get reconciled to those totals on the taxes receivables. There is a pension that the members of the employees of the municipality of County Pictou participate in. So the disclosure in terms of the expenses incurred by the county for the year. Note 6 on page 22 describes those restricted tax surpluses and the restriction period expiration. Page 23, note 7, the area rate. So this discloses what's being levied for these various types of protection services, just in terms of the street, fire, river, and sewer services, and the expenditures relating to those services. Note 8, contributions to boards and commissions. So these are annual amounts that are paid to some of these various boards that you see disclosed within that note. Page 24, note 9, other commitments. So these disclose what the municipality of County of Pictou has provided in terms of commitment towards the venture that are held by other organizations. And those other organizations are the Pictou County Wellness and Development Authority and the Shared Services Authority, the Hospital Renovation Project. On the bottom of page 24, the other note is where we're obliged to disclose the remuneration and expenses paid, either reimbursed on behalf of each of the councillors. Page 25, the segment and amortization. This merely shows where each of the amortization amounts fall within. Investment in New Scotland Business Development Corporation, note 12. This describes the participation with that incorporation with its 50-50 partnership, essentially, with the town of Glasgow. And the other matter, there's two things included in this note. One being that there is a temporary border resolution of 24.9 million. Of course, it has not been accessed at March 31st, 2021. And we're still obliged to disclose the fact that there's a pandemic. But of course, the impact on the municipality's financial statements has been minimal. And the last page to the note is note 14, related party note, where we're disclosing the balance and the description of that relationship with Riverton Guest Home. So there has been a warrant advance to the Riverton Guest Home, and they are paying on that annually. So it should be retired within 2 fiscal years. The rest of the pages provide some more detailed information. It's not my intention, of course, to go through those, but it does just provide some further detail on the schedule that we just perused.
Okay, thank you, Heather, for reading us through that. Everybody's got a good handle on it now. But are there any questions or comments for Heather on the financial audited financial statements ending 31st, 2021? Go ahead, Councilor Dave Parker.
Thank you, Warden Parker. My perennial question, and I asked it so that it's on the public record. During your examination of our books, did you find any evidence of misappropriation of funds?
So throughout our audit, we do, the team comes in and does work with various employees of the organization and performs tests of controls. And of course, we have various discussions with as many staff as possible, and we found no evidence of misappropriation during our audit.
Thank you. I have one more question if I may. This was raised at our meeting a week ago. We've actually left. Do you believe that our collection rate percentage is abnormally low? Collection of taxes that we refer to.
At a residential rate. Or both.
Well, the rate at which we collect the percentage
Right.
of taxes we collect, not the actual rate we set, but the percentage of taxes that are filed.
Right, so the collection rate has been consistently about 87 to between 87 and 88% annually. There's of course always room for improvement. You know, in a perfect world, that would be 100%. But it's certainly an opportunity to have a look at the policies to see if there is some enhancements that would achieve a stronger collection. So certainly there is room for improvement. Is it abnormally low? I wouldn't say it's abnormal, but always room for improvement.
Thank you.
Just to follow up on that, because there was some concern at the audit committee, 87% collected, 13% not collected. Does that mean that 13% is never collected, or does it just come in later than when it's supposed to? Like 13% of 15 million or whatever is quite a big number. close to $2 million. Are we saying that amount of money is just never collected year after year, or just that it doesn't come in when it's supposed to?
The latter. So it doesn't always come in when it's scheduled or expected. There are, of course, resources available to the municipality through tax sales to recover some of those that don't ever pay. So there have been some that are never paid, but it's not it's certainly not the norm. The norm is it's late or it has to go to tax sale.
In the tax sale, you collect some of it, but have you got any idea what percentage of the total taxes each year that we are unable to ever collect? Certainly not 13%.
I can't give you that number. We didn't do those types of analysis on the ones that have been written off, by 100% written off. We could certainly ascertain to gather it.
Or even the number that go to tax sale, I think would be a much lower number than 13%. Okay, is there any further questions for Heather tonight on Thank you, most of the satisfied everybody. So I take it we need a motion to adopt the financial statements. So does somebody want to move the motion to that effect? Moved by Councilor McKeel, seconded by? Seconded by Councilor Palmer. Okay, and if there's no further discussion, all those in favor?
Aye.
Yes. Carried unanimously. Thank you very much. Heather? And what is it, bring us a gift every year? This is good. Great. Okay, and the second item on our agenda tonight, folks, is presentation. And I believe that Sue Arsenault and Dominic Boyd are with us now. And the presenting on the Pictou County Community Health Center. They're going to explain to us what that is. Where we go from here. I'll leave it up to that.
This is the USB. Pictou list. Yeah, that's one final. If you want to dance this.
Oh, here, I can put one over.
Okay, thank you very much, everyone, for this opportunity to speak with you about the project to create a community health center in Pictou County. I'd like to introduce Sue Arsenault, who was in on it more or less from the start, a more recent person on the committee. So go ahead, Sue. Tell us a little bit about it.
Oh, okay. Good evening, everyone. It's nice to see some familiar faces around you. And it's great to have this opportunity for us to just give you a little information. Some people may not know what a community health center is, and we're going to give you a little opportunity to learn about that as we go along today. I'm one of the members who was fortunate enough to be connecting with someone named MacDonald, who lives in our county. And she, several years ago, I guess it's about three and a half years ago, she had moved back to Pictou County from Yarmouth and had been involved in a community health center in Yarmouth. And started talking to a few of us in the community about what that could look like for our county. So there was about 5 of us who started discussing the idea and just reaching out to a few people who were connected in health in the community. And several of us are retired and have worked in various areas of health, from women's centers to public health to working in hospitals and in the community. So that's really how we started to kind of form the idea of, maybe this is something that we could actually envision in our county. So I'm going to turn this back over to Dominic, and he's going to just walk us through a few slides to give you a little information.
Thanks, Sue. Okay, so we'll go to the second slide then, please. So who are we? We've created a working group. There's quite a few of us on it, 10 or 11 people, I think, consisting of community members, volunteers from across the county. And we've come together out of a shared concern. And we have a passion for the health and wellness of the people in our community, in our county. We represent many different experiences. For myself, I worked in a community health center as a social worker for 16 years in Ontario, and I have a lot of familiarity with how things are up there with the community health center services. We have had a lot of support in terms of some financial backing from the Aberdeen Health Foundation in particular, and from the Sutherland Harris Health Foundation, who contributed money so we could hire a consultant, carry the project forward. That's Pete Collier. And we've had support from Kids First and from Seniors Outreach in terms of managing that particular piece of it and the finances involved. And Nova Scotia Health are assisting us as well because they have data collection systems that can give us a lot more information about what are the health needs and concerns in Pictou County. Okay, next, please. So what do we want to do? The idea is to establish a community health center somewhere, somehow in Pictou County. Now, at this point, we are sharing information with people, starting to talk it up among bodies such as County Council here. We've focused on the other municipalities. And we want to go to the general public as much as we can. It is kind of difficult to organize meetings with the public because of the COVID issues. But nonetheless, we do want to get feedback from people about what their health needs and desires are and so on. This is a long-term project. We think it'll probably take several years. It usually does for one of these to get off the ground. We are carrying out the research to develop an actual operational model, which we then can advocate for with the provincial government, because funding for these kinds of health centers has to be obtained, and largely we would look to the provincial government as the main funder for such an organization. So we're gathering information and resources about the healthcare needs of Pictou County, and this will help inform our plans, building partnerships, creating awareness, which is one of the main reasons why we came here tonight, to let you know what our hopes are, and have a bit of a discussion around possibly some ways that you might want to contribute as the county council. So what are community health centers? Or what is one? There's different models out there, but basically they are not-for-profit organizations. They have their own board of directors. The staff are normally on salary, and the staff can consist of a number of different disciplines working in what we call an interdisciplinary approach. So you could have doctors, nurse practitioners, different levels of nurses. You could have a social worker or two. You could have a dietitian, a foot care specialist, and other health promotion staff, because there's a big emphasis on addressing the social determinants of health. Community health centers, when you look around Ontario, for instance, and you look in Nova Scotia too, you'll usually find that there's a particular reason in that area where the community health center is. The one that I worked in Windsor, Ontario, was located in a high school in a more poverty sort of stricken area of town. A lot of public housing, a lot of seniors apartments, and there were a lot of newcomers, a lot of immigrants, people whose first language wasn't English. And we created, I got in on it just as it was starting myself. I was able to create a sort of social work service out of that consisted of counseling services and some community development work as well as health promotion work. So it was a sort of an all-round approach. The idea of an interdisciplinary team is that you're all equals. It's not something that's led always by the doctor, for instance, or someone with a lot of letters after their name. All of the team members are equals. They will show each other respect. They work together as much as they can. So a doctor may see people on a kind of one-on-one basis, but may also be involved with the family in some way, or might be involved in helping give talks on health promotion topics, might be involved in some community advocacy work. So the arrangements are pretty fluid, that people can take on projects that are needed and all contribute as it's needed. So we, as I mentioned, we do look at this underlying social issues, what we call the social determinants of health. We have access to nurse practitioners and other related healthcare professionals. And let's see. Yeah, so there's a difference between community health centers and collaborative care centers, which you're probably aware of. Collaborative care centers are places where there's a doctor or two, nurses, and possibly one or two other sort of services available. But they function, the funding is different. They're usually paid salaries directly through the funding body as opposed to being employees of the center itself, from what I understand. Okay. So what have we done so far? Well, the team has been meeting, the working group, on a monthly basis, as much as possible. And we've developed a community engagement plan, which consists of coming out and meeting such as we are, and seeking the input of people who care about the health and well-being of the people in Pictou County. We've opened conversations with the municipalities, and we're looking at new kinds of possible partnerships. For instance, in Pictou, the old addictions treatment center is a place where it's being acquired by the John Howard Society. We're having some discussions around opening an office there we can use as a base for a project. And we're developed a partnership with Nova Scotia Health, which has the Research, Innovation and Development Division. They're the folks that can generate a lot of useful information for us about the overall health situation in Pictou County. How many people might have diabetes, how many people are suffering from this, from that, etc. And so we're committed to developing this business and operational plan in the near future. We hope to, in 2022, it's just about upon us. And I think by March, we hope to have something in place, a preliminary report on that. So the next steps, complete a full 2021 engagement, continuing to develop our partnerships, the business plan, and then we will need some additional funding to keep the project moving forward and begin implementing that business plan. So here's some questions I'd like to ask, what we'd like to ask. And so what, in your opinion, are the healthcare needs? What are the gaps in the county, in the various communities around the county? We can keep in mind that the community health center can look different depending on which place you go to. Around Ontario, there's a number of different models. We could have a model of one particular site where everything is within that one site. We could have a model where there's one site plus some satellites. So we have a number of different facilities that are all kind of equal in terms of who's working there and how many people. There are mobile services sometimes. Windsor Essex County Community Health Center has 6 sites, including a mobile site. One of them is street outreach, and one of them is specially tailored for people from a particular, I think it's a Mennonite community. So they try and adapt to the cultural and spiritual backgrounds of people as necessary in order to be able to deliver high quality care. So what are the healthcare needs? How would health services best be delivered, in your opinion, in our county here? And are there ways that you could perhaps think about collaborating with our working group in a meaningful way?
You're asking for suggestions now, Dominic.
Yeah, you're good.
Any council that might have some suggestions on, because we have, primary health care, I guess we call it, where you go to your doctor, you go to your, whatever, collaborative care centers and whatnot now, all kinds of, different meetings of heart groups and, mental health groups and other things, set up in the county now, so we're not taking that, anything to duplicate what's already happening, but, would anybody have any suggestions? Go ahead, then, Peter.
Thanks for coming,
Sure.
committees through that. No, I was just, saying, if we've got there's all the different sort of professions, in the medical field, involved in this, right? Is one thing I'm running into is people that, say they want to put in for Canada Pension Disability or something, and they don't have a doctor. They're a lot. They're just, it's ludicrous. So I'm just saying, if you had something in there to help these people, or many cases, it's another one that people are sitting at the hospital for 13, 14, 15 hours just to get a prescription. So I think stuff like that would be really good. Thank you.
And that's very interesting, because one thing that has come up in other discussions is the idea that if you come to the door and you don't necessarily need to see a doctor or a nurse, but perhaps you do need to get a prescription, or you need someone to help you navigate how to access something, or even sit down and help you do it. Those are the kinds of things we're looking at, because it's not just about your physical health all the time. It is to do with your social health, your mental health, how to access what's already in your community, or to find out what maybe what you need. So that's great, Peter.
Any other hands right now? I wanted to ask you about the staffing. It always becomes a problem eventually with everything. Oh, sorry. It always becomes a problem, dollars and cents eventually, and we know we can't have too much duplication. We have to try to do something that's not being provided, but so our healthcare dollars are stretched, of course, pretty thin, trying to provide enough staff, even just operate, our hospitals and the doctor's office and whatnot. So how many staff would you see working in a community health center, and based on what's already, I guess, in operation in Yarmouth or wherever else, and what's the chances of the government being willing to pay for that, or is it cost shared with other levels of government, or is it cost shared with the community, or how much would you need to operate a community health center? And where would it come from other than, or would it all come from the government?
You want to answer that, or do you want me to?
You have something, sure?
Well, it really depends on the individual community. If we go to Chester, for instance, Chester has done enormous fundraising within the community, and they have gotten a lot of money to build a building. And then they are doing some cost sharing with the province. So they do rent out some of their space to doctors in the community. And then they have the actual center upstairs, which includes different services. And I think it's important to look at that we may not, a community health center doesn't necessarily have permanent staff all the time. So you may have a doctor or a nurse practitioner who is there a couple times a week, but there may be a social worker and a physiotherapist who might be there another day doing particular services. And we have to look at what is your community looking like. For instance, we are very spread out here in Pictou County. And we on this west side, we know sometimes it's very hard for people to get across that causeway because we have poor transportation and something like this. We live in rural areas. I live in a rural area, Scottsburg. So when you talk about mobile units or going out to existing community centers and providing some care in that kind of a environment, it's wide open, really. It's what communities are saying we need. So when I go, say, to River John, what's there right now? We might have a couple doctors. We have a school that is not being utilized. Is that a space that could be utilized on a part-time basis? So these are the kind of ideas that community health centers are open to. And that's why we're going out into community right now to get some ideas of what are people needing and how could they envision it. You were mentioning about a mobile unit. We know in Halifax, the North End Clinic, which many of you have heard of perhaps, they are a community health center. They're the first one in Nova Scotia. And they've been here for at least 20 or more years. And they have a mobile unit and they go out and do all kinds of things. During COVID, they've been doing a lot of care through their mobile unit. So it really is kind of wide open. And that's why we're coming out to the community to kind of, look at what do you think is missing? And how our next question is, how would health services best be delivered in your community that perhaps are not being delivered now? Is there a different way for us to do this?
Councilor Brewer. Go ahead.
Thank you, Mr. Gordon. I was wondering in your discussions with your own meetings, how often mental health comes up? It must come up an awful lot.
It does.
We were abandoned a few years ago, like we were promised something, led down the wrong path because they didn't fix something up. They're told to destroy what was there. So their way of handling it, and still is their way of handling it, is a telephone number. Well, a telephone number doesn't do any good for somebody that needs help right now. Everybody has got that telephone.
That's right.
Wallet.
That's right.
And something bad happens. I really think that if there's priorities with your group, mental health has to be looked at an awful lot more than being looked after here. In other places, it's got a few beds or a little wing at the hospital or something. And there's certainly lots of beds over there that could get the right people to look after them. But I just have a real interest in that because I'd like to see something really happen there in the next few years because nothing happened in the past years except postman down. I just wanted to vent with that, so thank you.
Sure.
Okay, and I've got Councilor Keel left.
Excuse me, may I just respond?
Oh, sure, yeah, go ahead, sorry.
We are doing research on the mental health side of that. It's extremely important. And, for instance, we do have in our county, we do have the mental health and addictions clinic. And so what we do, we wouldn't want to necessarily duplicate what they're doing, but we would want to, if we have a community health center that has some kind of mental health and mental wellness component, it would fit the needs of people who don't kind of qualify in some way for the existing services. We would seek to complement what is actually happening, not kind of take it over or duplicate. And on the other end of it, we're talking about beds and so on. I know that you're referring to having an adequate psychiatric service available. So that's the kind of thing a community health center would probably do some advocacy around, if at all possible, in order to try and improve psychiatric services.
I think that's the words I was looking for. I didn't want anybody to do it, I just want, yeah, get something back to close to what it was.
I have a meeting scheduled for a little later in December with the manager, Monica Thompson, at Mental Health and Addictions, so we can discuss this very much. So thank you.
Good, now we have Councilman McKeel.
Thank you, Mr. Warden. I really like the idea of the mobile unit that you spoke of earlier. I think there's lots of rural Pictou County units that are Pictonians today that aren't able to, whether it's because of transportation, and a lot of people want to stay close to home. And maybe they don't have the help to go across the causeway, so to speak. So I think that would be a really great idea. I have a few questions, if I could, Mr. Warden. My first question has to do with staffing. So there's about 80,000 Nova Scotians right now without a doctor. We know that a lot of our doctors are overworked, that they have tremendous patient loads. How do you plan on staffing that? Are you planning on recruiting more? Is that part of it? There's a lot of, like I was saying, doctors overworked. Is that, how do you plan on staffing those with doctors and nurse practitioners and nurses and stuff? And we seem to be already pretty, thin with that. You mentioned a couple hours a week, so it would be something that they wouldn't be at full time, but.
I think again, that's really going to look at what does our model look like? And what kinds of services are we really needing? Yes, we know there's a shortage of doctors. We are actually in Nova Scotia employing more nurse practitioners, and they're working to a very high scope of practice, and also nurses as well in the community. And oftentimes they are not given an opportunity to work to that capacity. So what we have learned from other community health centers is that people are going to the center and they're realizing that perhaps it's a pharmacist that they could see to actually have their medications renewed. Or it is a nurse practitioner who could be their primary care person. Or they don't need to be actually seeing one of those people. It may be a social worker. So one of the goals that we're looking at as a community health center is to have some of those people employed. And what we're finding in some communities is doctors are in private practice. They are coming over and working in the community health center for part-time. And what we're also learning is that the Department of Health is paying those doctors. They're still getting paid the same as they would if they were being seen in a regular clinic. So there's different models out there for us to explore, and we are continuing to learn. Right now, I think there's 6 other community health centers in Nova Scotia. So we are really working with them to try and find out what are you doing and how's it working? How are you getting your staff? The other thing is too, I think that we're realizing that, as I mentioned before, not everybody needs to be seeing a doctor or a nurse. perhaps they need to see someone and they don't know how to access that care. And I think it would be, we are hoping that we're going to be able to talk to some doctors and nurses who are on the front lines, because they can give us some insight into what are you actually being asked when people come to see you. You know, we know there's a whole list of health things that happen, but we also know there's other social determinants of health, like housing, poverty, lack of transportation, all of those things, you know, addictions, all of those things are impacting on people's health. So we're looking at, through community health centers, prevention and really helping people to look at their health in a different way.
And I could say that there's an education component as well to the community. I think we always think sometimes that we need to see a doctor. So I think if there's a valuable piece there that can be looked at, about informing them, well, you can see a social worker for that, or no, you can see a pharmacist for that. So I think there's an opportunity there. And one last question, if I could, Mr. Warden. So I guess this is kind of like a philosophical question, but why not leave this to Nova Scotia Health? Why is it something that you feel that that this, I guess, what is the difference that you're hoping to make, and the differences that you hope to achieve? Because I think we always think of healthcare as a provincial directive, that it's kind of a government-led thing, and I think this is kind of like a new perspective. So I asked that, why not leave this up to government and what you hope to achieve, and what differences make the community?
That's an excellent question. And part of the answer is that this is about communities taking control of their own health, of their own needs, coming together and working together. And I think that's the basic difference, rather than waiting for government to move. Government's moving like glaciers moving sometimes. And this is a way for communities to feel empowered. We own our center. We built our center. This is the kind of attitude that people who come to the community health center are members of the center. They become members, and they can be on the board. They can attend the annual meeting. They can have input. The place I worked in Ontario, we had a community health advisory team. Check. Once a month, I would meet with people from the community, and we would discuss how things are going, and we would share ideas about what kind of programs would be valuable, etc. And I would feed them pizza, because it was the summertime, respecting to people who need a little treat. And we had a lot of, and I ran that committee for about 10 years. So it's an opportunity for people, as I say, to take charge of their own health, take charge of their own needs, and have an input into the solutions, the services. Well, so there's a huge philosophical piece around the community health centers. And when you look at all of the different community health centers, they're all unique in their own way. They've arisen to deal with the particular population, particular needs. It's usually people that are lower down the total pole in terms of income and living standards and so on. People who are struggling. They're the ones that need the opportunities to come together, help each other, and get help from various professionals in a team-like manner. That's how I see it. Anything you'd like to share?
Well, one thing I'd like to share is Tim Houston actually, during his campaign, visited a couple community health centers in Nova Scotia to get a little more information about what they are about. And we have actually talked to a couple other people who are in our provincial government to help them understand that in other provinces, like Ontario, like BC, the Department of Health, the government, is actually very engaged in developing community health centers, because they realize that we have different as Dominic is saying, a different approach to engaging people in their own health. And yeah, in BC in particular, they are helping to develop community health centers and trying to make them unique to whatever community you live in. So we're starting at the bottom of the totem pole here as far as access to funding and those kinds of things. But we are trying to get really educated ourselves and learn what else is happening in other places, so that we can, once we get going a little bit more, that we can bring this back to the community and say, okay, this is what we've learned. This is what's happening in other places. And I guess we kind of want to think big in that Nova Scotia has the potential to really look at our community differently. You know, we're different in Pictou than across the causeway. Our needs are a little bit different. We all have rural people, but this side of the county, for instance, is very rural. And so, you know, we do recognize that some of our needs might be a little more unique in what we need. So that's why we're trying to get people to really think about it. So, you know, we're not going to get answers a lot tonight, perhaps, and we don't have all the answers. But we really hope you'll go away and think about it. And yeah, we'll come back and see.
Thank you. There's a philosophy of localization and decentralization. We're all very good at criticizing healthcare system because it's all sort of from the top down. I know I worked with Dominic, Moses, the crisis mental health group, on that. We're so used to being told the same things from the top down. And it's so frustrating for everybody trying to make changes because it's well, we're going to treat you all the same. It's very corporate-like. And like you said, so we're not the same. We're different, even within communities in this county, we may be different in what our needs are. So it's a good philosophy of let's do something for ourselves, and then we can have more control over it. Yes, let them help us a little financially or whatever, but don't let the fellows in Halifax or wherever the center is dictate everything. It has to be the same everywhere because that's the way we do it. I've got Councilor Turner next.
Thank you, Mr. Porter. Thank you, Sue and Dominic, for your presentation. I applaud your efforts greatly for what you're trying to achieve. One of your questions is, what are the healthcare gaps in your community? And I'm coming at this question from a perspective of a patient. If I was a patient, one of the thing that really strikes me in your presentation is about the social determinants of health. And poverty is a major factor in accessing healthcare. And talk about universal health, but there's no such thing as universal healthcare because there's so many things in healthcare that people can't access simply because they don't have the money. So I guess my question is, in terms of your model, if you come as a patient that doesn't have private insurance, they don't have coverage, they're looking for a service that's outside of the healthcare system that we have, will they still be able to access your service? How do they pay for it? How does, if I come and I'm looking for medication and medication is too expensive, like in Chester, they build facilities, but do they also help subsidize the care itself or the prescription? How would that work? How does the financial model work in terms of access to care? Thanks.
My recall, I think in Ontario, the people who were members of our center, connected to our center, did not have to pay for services. The question of prescriptions, for instance, is important. One of the things we did was we accepted donations of common medicines. You know, we didn't make promises that we would only stock, you know, this company or that company. But we did accept donations, and so that did help to meet that gap to some degree. But, yeah, people would not normally be expected to pay. Like if you want foot care, you know, nails, whatever, you're gonna pay $30, $40 for a visit. But if you've got a podiatrist working in the health center, that's something we offer as a service. You don't have to pay for it. I mean, that's the potential business model. I mean, I'm thinking ahead to how that could look and how it's looked in places where I work. The actual business model will need to address those questions that you're raising.
To me, that's the,
Obviously.
yeah, there's like, you talk about gaps.
Right.
Gaps in affordability.
Yeah.
If you're well off, you can access the healthcare system in a number of ways. Private insurance.
Yeah, you can go to that. That's if
You're coming from a point of advantage, kind of, that you're coming from somebody that's in a state of poverty.
Right.
So that to me is a big, big gap.
Absolutely.
So anyway, I think that however you address that, good luck. That's a big.
Well, it is a big one, and I think, I think that's something for us to really look at, and thank you for bringing that up, because it's interesting, you know, people in the community will say, how can we help our community? Right now, of course, Christmas is big, right? Everybody's asking, how can we help? But this is, you know, these are some things that I think we could really make a difference in our community, when somebody knows they can walk through the door and they can get a service at a minimum price. Or if we have some donations that we can say, okay, we're going to use that for foot care, we're going to use it for helping with prescriptions. We're going, sanitary supplies for women is a huge gap in our community, and in many health centers, they're there for free. So, you know, those are the kinds of things that we forget about, and you're right, Larry, we don't always recognize those gaps for people. And we have a high level of poverty in Pictou County, we know that. We have many children living in poverty. We have many children who are getting their lunch and breakfast at school because they don't get it at home. We know those kinds of things are happening. So those are the kinds of things we really need to make sure, the community health center is going to be aware of. So it's going to be for all ages. It's not just for particular people. We're hoping that we can open the door and help whoever comes in.
A couple more councillors on the list here. Councillor Dave Parker.
Thank you, Warren. First of all, Sue and Dominic, thank you for coming here this evening to fill us in on this very, very important issue. There are many things you said that I agree with, but I'm not going to spend all the time there repeating. In the community that I represent, in and around the town of Westville, the Salt Springs and MacDonald background, I would estimate that 1 out of 2 people not have primary care. We lost a little over a year ago, we lost Dr. Smith, that was 100 patients. Dr. Rivera was coming back, lost some others over the years too. So it's almost a joke at home. Who's her doctor? I don't have. But not very funny. I recently had a neighbor's diagnosed with serious cancer, and she had no doctor. She couldn't even get some of the required tests. She didn't have a doctor refer to a specialist to get the test. It's not funny at all. It's very sad, and it's risking her life.
Yeah.
It's not uncommon to have to, you know, try to find a workaround. You have to wait 3 months to see the specialist, and you have to wait 8 months to get the test. Anytime you have cancer growing in the body, you know the results could well be. So that's by far having a primary caregiver. Now that particular couple, they were offered a nurse practitioner, as we were in Sheet Harbor. My wife and I, We declined because it's too far away. They felt obligated to accept it. Now, where are they on this? Oh, they're taken care of, right? No, they're not. They don't have very serious health zones. And then it's frightening, the state that our healthcare is in. So I can't outline all gaps. They're so huge, and so many of them. Okay? And I realize it seems like you're probably talking about a facility that would help, particularly in Pictou West. Technically, we are Pictou West, but our town is westful into Glasgow. But anyway, that's the first. There's just huge gaps. You know, there's certainly poverty, ability to access. But now that couple I spoke of, they're financially stable. They're able to travel to Sweet Harbor. But I mean, it becomes a little full-day trip. 125 kilometers to get there. And while it's on the roads over this morning, there's some days where it's difficult to travel. But anyway, I applaud what you're doing. I'll offer any support I can. And there's just so many things that we have to start tackling. One of the big ones, though, that is in 13 months now since I have been a doctor, and my health's not great. I'm not diabetic. I'm getting used to for the last year, taking insulin. Still adjusted to that, so I don't have anyone to oversee it. I have switched pharmacists, found one who is very proactive, and he has given me some good advice to where to go and get prescription treatment or adjustments. So there's a huge need for information out there for what I call workarounds. Basically, you can access some medical care, even though you don't have a designated primary health giver. So those would be those are some of the gaps, but information, the ability to call someone and say, look, here's my problem. What can you suggest? Doesn't have to be a visit. It has to be somebody that knows the ins and outs of the system. The pharmacist who I've worked with for the last number of months is very good. Probably why I switched to that particular pharmacist. Anyway, I could go on all day, but I'm not going to.
I know.
No.
Okay, I've got a couple more councilors on my list lined up here soon. Councilor Marinelli.
Thank you. I'm interested to see how this works for you. I'm overwhelmed with what you're considering. But Larry Turner asked the question that I was going to ask about the coverage. Will you be covered if you have a medical service of your own? Will you have to pay out of your pocket? But I'm not sure spreading funding across the board or thinning it out is going to help by taking from Peter to help Paul. And I hate to see any of our services in our hospital disappear that we have now, and like we're losing things all the time, and I don't want to see us lose any more. But my question is, time wait's a big factor right now. You go there and you may as well pack your suitcase and your lunch. So having said that, when you say if it's geared for this side of the causeway, what's going to prevent people from coming from that side to your services? So then we're going to have that time wait factor again. If the people are going to be able to travel, who's going to stop them from traveling to where they're going to get the service that they need?
I think we'll go to the wall on this.
Great.
I'll let you go to answer. Better answer than I
That's
can.
a loaded question. You know, we're looking at this as for Pictou County. We are, as we're going around the county, we're realizing that there's gaps in different places. We may end up having, and because we're just developing as a business, looking at business plans, could be some services here 2 days a week. There could be services in New Glasgow or Sullivan. We don't know what the model's going to look like, or if we have a mobile unit, it could come to this side of the causeway a couple of days a week, and it could be in another part of the county another day. We may have a physical space plus a mobile unit. This is what we're trying to figure out. And really, we're trying to make healthcare as accessible as we can. And everybody's trying to do that. They're trying to do that in our collaborative practices, and, you know, we're trying to work with all our other primary healthcare services. So it's not like they're gonna go away, they're here. We're trying to just develop something that will be part of the whole system. So we're not trying to take any services away from anyone else. We're trying to look at what kind of service providers are out there that could be filling the gaps that are recognized in our communities.
And further to that, when you look at these gaps and you design a program that does what we call upstream work, if we can help people through, for instance, a diabetes program to live healthier, they're going to be less involved with having to go to hospitals. The big costs that go along with something having not been controlled properly. So then you're looking at vascular problems, losing a leg, something like that. These things can be prevented. And, you know, where I worked, there was a diabetes program. It was all about education and helping people to be as healthy as possible with that condition. So maybe it'll kill you in the long run, but you're probably going to live healthier longer by having these kinds of supports. So community health centers are really good at providing these kinds of programs to help people take control of their health more, take charge of it, and live healthier. That decreases the burden on the tertiary care system, hospitals and so on. So keep that in mind. It's cost benefits.
Sometimes when the services are offered and they're good, then they close with benefits acts. I'm not saying you're gonna take from it. I'm just saying that when something works someplace in another location, sometimes they close what previously was there. And I wouldn't want to see that happen. But for me, the wait time and given staffing is gonna be a concern.
Oh, for sure. I think one of the things that we have learned from other health, community health centers is that they provide an environment, a place for groups, community groups to get together and do things, but they also provide opportunity for education, educational group things. So we look often at, I need a service, I need to go and talk to somebody about my diabetes, but perhaps there's 5 other people who do as well. So can we get 6 people in a room with a healthcare provider who can sit down and help you solve some problems and look at how to change what you're doing, perhaps with your care of your diabetes. You know, we still have to get the people to the place, and that's our other challenge. Is right now we know there's people are not getting to services because they don't have transportation. And I know that has been a huge effort made in Pictou County for transportation. And we're helping some people, but it's still there. So that's where moving services around the county would hopefully make it better.
Sounds like a good model, that moving the service of people to the people that service on that. Councilor Power, okay.
Thank you, Warden. Thank you, Susan and Dominic. My concerns are similar to the other councils that spoke here tonight, and next lots in my community, these lack of doctors. Because I know many of my residents don't have doctors. And problems is trying to actually get more doctors and things like that. I don't know where they come from, because there's a shortage of doctors everywhere, right? So my thing is for your private, this here healthcare, community healthcare center. Now, if the doctor comes in there and sees patients and things like that, he would get paid by the province for this. Now, will he pay you guys for using the facility, or is that how offset the expenses of that facility?
Well, you know what? Right now, we can't really answer that question because we don't know what the model looks like. In some places, that happens. But the doctor would get paid by the province, so he wouldn't have that expense. As far as how the center is set up, to provide space, that's something yet to be determined.
So, and then you probably can't answer it. I was wondering what your approximate budget would be for a facility of this nature. You would have any,
Right now, that's one of the things that we are working on, what does the business plan look like, talking to other community health centers, just to get a handle on, okay, yeah, how much is it costing me to run your community health center in the model that you have?
do you have a meeting currently with the province, or do you have commitment from the province if you do set up a facility like this?
We're not at that stage yet. We have had conversation and we have actually sent out letters to meet with, Premier Houston and, Carla and our Minister of Health. So we have reached out to them and, we're waiting, hoping that we will get their ear to be able to sit down and talk to them about.
What will that done?
In fact, that is on the list. Yeah.
Those are the list, because if this is a county thing. that's what
Exactly.
I'm saying.
Yes, yeah.
So, and here's my other question. Now, you're wondering how we contribute, no doubt it's through funding, things like that, right? And that comes down to higher taxes for residents. Right now, I get what the people say, my taxes are too high. And really, our taxes are very reasonable in county, but the people out there that can't pay the tax, things like that. And for us to help contribute to a facility like this, we'd have to, no doubt, put our taxes up. So that puts an added burden on our residents, because if you're looking at a municipal contribution for the whole county, we take up over 50% of that contribution. So if you're asking for $1 million a year, this county will have to pay approximately $500,000. So it puts that extra tax burden on our residents. Okay? So, and the other thing that just didn't like pick lists. I don't mean that way. We're all like, we have the same problems in the east as we do.
Oh,
in the
yes,
west.
I'm not saying that you
No,
don't.
I know, but that's been brought up here. We have the same problems. It's not just here in the west, it's there in the east also, right? So everybody's going through the same things. So if you're setting up a practice, like, I know people say, oh, can't get across the cost. Which people need to get across the cost. So you have to look at maybe 2 locations to contribute that way.
Yeah.
But those are just things, and I didn't think you're that far along anyway, so. But, thank you for your presentation, and see where it goes.
And thank you for bringing up the idea that, yeah, we have to be sitting here on the west side of the county tonight, but we are exploring all communities around Pictou County. And it actually has come up in conversations, the idea that they're, depending where this ends up, that if we really were lucky to have 2 community health centers, one on either side of Pictou County, that would be awesome. But yeah, we've got a long way to go, but we want to hear everybody and, yeah, so thanks for that.
Thank you.
And Councilor Thompson.
Well, that's already been said, but I guess to add to Councilor Palmer's, one of the rural remote area, I'll take on the tour of my district of people in half day, so.
And what area are you in?
I have the southeastern section of Project County, just get the left, so I got suburban, Pleasant, Sunny Brae, and then Blue Mountain, East River St. Mary's, so. And then everything in between, there's a lot of deer and moose out there too. There's a lot of people out there as well. There's some opportunities with this concept for communities. I think the physical structures are already in the community. I think of 10 community centers in my area would love to have a footprint, right? Or diabetic clinic. There's fire departments around it, most of that stuff. We don't need to bring in new buildings
could be that decentralized model, so I guess to say, when you get to that point, but there's opportunities for communities to get involved in this, and really take ownership of it, of this. I'm curious about what Yarmouth is doing. Can you explain what they've done down there with the community health center?
I wish Bernadette was here, she could give us a little more perspective. I do know that they have, they've been working with the women's center down there. And, were able to, expand, the use of the building that they were using. They had one doctor who was working in their center. Other than that, I can't give you a whole lot of information. If you would like me to, go up with Bernadette, she could explain a little bit more.
I'm just curious, because they're doing a lot of good things down there.
Yes, they are, and
Residencies and stuff like that, and finding housing for the residents to come from the medical schools. And they're all set up with the park and all that stuff, and the track. I guess that's the reason the other thing is, have you been in contact with other organizations that help Pictou County or something like that? It's the call of law.
Right.
Have you talked to her about given the needs that she's sort of come across? She's sort of in charge of recruiting.
That's right.
Physicians and medical professionals.
we haven't talked to her, as far as I know, unless one of the other members has. She is on our list of people of resources.
Just that she would be a good resource for it.
Yes.
I think one of the things that, that we're just sort of at this stage where we really are trying to get a handle on what's out there, what exists right now, as far as services go. And so we actually, that's one of our tasks that we are doing, is gathering that information. And we are trying to, we're working quite closely with Michelle Ferris. She is with the foundation, and she is the person who is helping us network with quite a few people around the I think the big thing is that when you talk about utilizing community centers, et cetera, I think that's where we kind of are not doing that very much. Before COVID, I know COVID has changed things quite a bit. But, you know, I used to work in public health. I was a public health nurse. And when we had flu season, we went to so many little communities and did flu clinics. That was one of the things we did. And we reached so many people, and we brought that service to the community. And so we didn't go down to East River St. Mary's, but we certainly went beyond Plymouth. So those are the kinds of things that community health centers are trying to look at. You know, how can we utilize what's there? So that is definitely something to put on our list too.
Mr. Chair, thank you very much for telling me. I certainly appreciate the information. It's kind of exciting for the potential that you're proposing. And people like yourselves, just include the organization work to move forward with these projects. It's going to be better for us, for sure. Really interested in seeing the business plan. I'm sure that makes things a lot easier for you to do. And you're, are you looking for more members? If you're maybe big enough?
You could probably use a few more people, particularly if they bring a certain expertise and a willingness to, you know, do things, be involved. Not just involved as a figurehead or a token member, but someone that really wants to contribute, probably be interested in, would be delighted. Following along from that, there's a lot of ancillary things that can happen. For instance, when we got about a dozen counselors here, would it be possible for down the road when we're ready, and COVID allows us to have community meetings? Could you organize community meetings in your own writing. So that we could potentially meet more broadly with the public. That might, I'm sure we would appreciate that.
We do have ratepayer meetings when COVID's not on, which is a general community meeting.
Okay.
A lot of times, we councilors are looking for a guest speaker for their ratepayer meeting, so you propose to fit the bill there, and the stipend is very high, and they do well, I think.
One of the things that we are doing right now is trying to connect with, municipalities, other services out in the community, but we really want to hear from our community. And so we're hoping as the winter improves and we are able to have more face-to-face type of meetings, because really the people who need the services beyond us, we all need services, but we really need to hear those first voices of people who are really struggling. And, there's things that we're forgetting about. We're thinking about, well, what's my need? But, we think about somebody who's a young mom, she's got 3 kids, she's got to go to an appointment. How's she going to get there? Who's going to help her look after the kids while she's in her appointment? And she gets to her appointment late, and somebody gives her grief because she's got her kids in tow. And she's like, well, this is the only way I can get here to my community, to my appointment today. So those are the kinds of things that we need to look at as a community, and how can we help people access services and get what they need. So we really need to hear from the people who live in our communities. And I know you are listening to them all the time with all kinds of things. So that's what our goal is for 2022, first 6 months, is to try and engage with our community. So this is the beginning, so we would love to hear on how we can do that.
We're going to add one thing before we wind up here. There's a group of people out there that this might help. I don't know how large the group is, but we all have health problems from time to time. But there are a certain group of people that are. I heard on the radio the other day they actually call it some kind of phobia, but they're scared of doctors and such. And it's really, there are some people who spend their whole life here, they're ever seeing a doctor. They just at all costs avoid going to the doctor. And if you had something local in the community, then maybe a family member, a friend or somebody might be able to talk them into going there. And that might be the first step, but then getting them. They may have, as you age, you get some more serious problems and whatnot. They may have some very serious stuff starting to happen, but they can put up with it. And until suddenly something happens. But I think if it was more local, the fear of going into the hospital for a lot of people, even, with the waiting time and the process of people and everything, even before COVID, there was a fear for that for a lot of people. And like I said, I don't know how big that group is, but I know those people exist. That if it had something in the local community, if something wasn't so structured, it might be easier to talk over President Bill or somebody into going to a facility that's local. And that they may need to have to go to a hospital with a doctor since the person's very sick. But at least it's an easier first step, I guess, with that. So there's advantages, I think, if you have something local and something that you feel more comfortable with. And if you're helping people out, the social determinants that you call them health are so big. Poverty, transportation, housing, those are issues far beyond what your group or anybody else by themselves can handle. But you can help people a little bit have those issues, maybe give them some direction, as to where they might find some help. Back to what Chester said about mental health. Phone numbers sometimes aren't what you need. You need to actually talk to somebody who might be then be able to encourage you to take another step in some direction, that would help. But just to say, well, look, here's 6 phone numbers, phone any one of them and help. That becomes a turnoff for a lot of people. So again, I appreciate you coming tonight. Debbie has another question, sorry.
That's okay. I just wanted to leave your contact information, to get them to the council so we can contact you.
Good idea.
Sure.
Okay, so thanks again for coming, and we'll keep in touch as you move along, and I know Keith is doing some research work for you and whatnot. As it develops, that's how we can link everybody around the table. Interested in what's happening.
Can you send us the whole presentation?
Thanks, everyone, for your input, listening to us, sharing your ideas, and we really are, we're very excited about trying to get this happening, and it is a slow process for everybody. We'll keep you posted.
Okay, thanks again. So that's the agenda, folks. I just need a motion for adjournment.
Robert?
Oh, sorry, got somebody else here. Sorry, I almost forgot about the people on the screen.
Oh.
Okay, go ahead, Mike.
Oh, that's one.
I just want to say that tonight I had the opportunity to go on our own internet and the test station here in Hardwood Hill, and it is unbelievable how great it is. The clarity is perfect. The sound is 100%. And boy, if we have all our internet's going to be like this, there'll be some happy people in Pictou County. So I just wanted to say that because it is perfect. Thank you.
Thank you for that, Wayne, and we'll be at first, you'll be like the first man on the boat, you know. Thanks for saying that. We have a motion to adjourn, all in favor? Motion carried.